Hello everyone. Today we are going to learn about abdominal radiography. There are few imaging modalities: plain radiography of the abdomen, CT, MRI, nuclear imaging and ultrasound scanner. Possible positions for basic AXR. Usually APPA abdomen will be taken as the basic radiograph for abdominal region. Standing up, erect APPA, supine AP. Patient and equipment preparation. Patient preparation. Ensure that all metal objects in the abdomen and pelvic region are removed. Ask the patient to remove all the clothes in the abdomen and pelvic region and provide a gown to wear. The patient should be provided with a clear explanation of the procedure. Patient should be instructed about the respiratory technique used during the exposure. Arrested expiration is used. If possible, a rehearsal should be done on this before positioning the patient. Use appropriate radiation protection measures for the patient. Use thyroid shield, gonadal shield and eye goggles. Equipment preparation. Select the suitable cassette size according to the size of the patient. Usually 35-43 cm cassette is used for adults. Position the side marker properly. Place the cassette longitudinally in the erect bucket or table bucket tray. Prepare the X-ray tube according to the examination with 100 cm FFD. Prepare the other useful accessories such as immobilization devices, compression bands, etc. Select the exposure factors correctly according to the patient's size and age. Radiation protection measures for the patient. Avoid or minimize the repeat examinations by identifying the patients correctly, giving a proper explanation about the procedure to the patient, following a well-planned procedure. Follow LARA principle, apply appropriate exposure factors, provide lead protective things such as thyroid shields, gonadal shields, and eye goggles. In KUB examination only for males, we use thyroid shield, gonadal shields. Collimate the beam properly to the area of interest. In the case of a large abdomen, a compression band may be applied to compress the soft tissues to reduce the thickness of the abdominal area, and therefore the radiation dose given to the patient can be reduced. If the patient is a lady, especially in the childbearing age, ask about the pregnancy. Follow the 10-day rule if she is suspecting the pregnancy. For the radiographer, wear the lead apron and stay inside the cubicle while during the exposure. For the guardians, provide a gonadal shield, thyroid shield and eye goggles if available. Then erect anterior posterior radiograph. What are the indications? Obstruction of the bowel, toxic megacolon, ingestion of foreign objects, gallstones, aortic aneurysm. To demonstrate the abnormal fluid levels in the abdominal cavity in the assessment of ascites, perforation, intra-abdominal masses, areas or postoperative complications. Prior to the introducing of a contrast medium as a preliminary X-ray tube. Images. 2. Assess the adequacy of bowel preparation in alimentary studies using barrier preparations. Positioning of the patient and image receptor. Positioning of patient and the image receptor. A 35-43 cassette is placed longitudinally in the erect bucket tray. For the skull, for the chest and abdominal, also we use longitudinally the cassette. Patient stands or sits with the posterior aspect for AP, anterior aspect for PA against the vertical bucket surface. Patient's legs are placed well apart so that a comfortable and steady position is adopted. MSP is adjusted at right angles and coincident with the midline of the buccal surface. Pelvis is adjusted so that the anterior superior iliac spines ASISs, posterior superior iliac spines PSISs are equidistant from the erect buccal surface. Then direction and centering of the X-ray beam. Horizontal rays directed, CR is perpendicular to the image receptor. Center point is on the midline 1 cm above the line joining the iliac crest. Center point is on the midline 1 cm above the line joining the iliac crest. The position of the cassette should be checked to confirm whether the center of the cassette is coincident with the horizontal center line of the primary beam, and position of the cassette should be adjusted if needed. Collimate the beam and include diaphragm superiorly and the symphysis pubis inferiorly and the abdominal walls laterally. Collimate the beam to include the diaphragm superiorly, symphysis pubis inferiorly and the abdominal walls laterally. Used in a short exposure time, the exposure is taken on arrested expiration. These are some images for erect position. This is the radiograph. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. There are some issue, some error. It may be some hair bands or hairpin. Then evaluation criteria. Evidence of proper collimation should be there. Area from the upper abdomen to pubis symphysis should be included. 2 radiographs may be necessary to cover the whole abdomen if the patient is tall. If the patient is tall, 2 radiographs may be necessary to cover the whole abdomen. Proper patient alignment should be there. This can be ensured by following: centered vertical column, ribs, pelvis and hips equidistant to the edge of the radiograph on both sides. No rotation of patient as indicated by the following: spinous processes in the center of the lumbar vertebrae. Okay. Ischial spinous of the pelvis symmetrical if visible. Ala or wings of the ilia symmetric. Appropriate radiographic contrast must be there with soft tissue, grey tones showing the following: lateral abdominal wall and peritoneal fat layer, flank stripped, Voss's muscles, lower border of the liver and kidneys. Appropriate radiographic contrast must be there with soft tissue, grey tones showing the following: lateral abdominal wall and preperitoneal fat layer, flank strip. The psoas muscles, lower border of the liver and kidneys. Right or left marker should be visible but not lying over abdominal contents, and the upright abdomen should be identified with appropriate marker. Okay. Again, evaluation criteria. Evidence of proper collimation should be there. Area from the upper abdomen to pubic symphysis should be included. Two radiographs may be necessary to cover the whole abdomen if the patient is tall. Proper patient alignment should be there. This can be ensured by the following: centered vertebral column, ribs, pelvis and hips equidistant to the edge of the radiograph on both sides. No rotation of patient as indicated by the following: spinous processes in the center of the lumbar vertebrae, still spinous of the pelvis, symmetrical if visible, ala or wings of the ilia symmetric. Appropriate radiographic contrast must be there with soft tissue gray tones showing the following: lateral abdominal wall and preperitoneal fat layer, psoas muscles lower border of the liver and kidneys. Right to left marker should be visible but not lying over abdominal contents, and the upright abdomen should be identified with appropriate marker. Common faults and remedies. Faults. First fault: failure to include symphysis pubis and diaphragm on the same image. Reason: due to incorrect cassette size selection. Region is not properly centered with image receptor. Incorrect center point is used. Due to incorrect cassette size, region is not properly centered or center point is wrong. Remedial action: select the correct film size according to the patient. Ensure that the cassette is centered well. Two images are acquired if 35-43 is not possible to cover the whole abdomen. Second fault: failure to visualize the lateral extent of abdominal cavity. Failure to visualize the lateral extent of the abdominal cavity due to incorrect cassette size, poor patient and cassette positioning, tube is not centered to the bucky, to collimate field. To collimated field. Remedial actions: carefully position the patient and the cassette, center the extra tube to the bucky, select the correct size of the cassette according to the patient size. Other fault: movement and sharpness due to patient movement. Selection of the shortest exposure time. Advise the patient not to move during the examination. Another fault is underexposure or overexposure. Incorrect selection of exposure factors. Correctly select the exposure factors according to the size of the patient. Other one is presence of artifacts such as buttons or contents of pockets due to the insufficient patient preparation. Prepare the patient properly prior to the examination. Then supine AP projection. What are the indications? Renal pathology like kidney, urinary bladder stones, calculi, named as kidney, uterus and bladder, KUB, X-ray images. Bowel obstruction, gallstones, toxic megacolon, aortic aneurysm, same as erect position. And the renal pathology like kidney, urinary bladder stones, calculi like thing in supine position. Prior to the introduction of a contrast medium as a preliminary X-ray image. Example: intravenous urography IVU to demonstrate the presence of radio-opaque renal or gallstones KUP image. Ingestion of foreign objects. Positioning of the patient and cassette. A 35-43 cassette is placed longitudinally in the table bucket tray. Then positioning of patient and cassette. A 35-43 cm cassette is placed originally in the table bucket tray. Position the patient supine on the imaging couch or trolley with the MSP as right angles to the tabletop and coincident with the midline of the table. Pelvis is adjusted to bring the ASISs are equidistant from the tabletop to avoid rotation. Hands should be kept on the chest to bring them away from the primary beam. Knees should be flexed and feet should be kept on the tabletop to reduce the lumbar curvature. Therefore, give a good contact between posterior aspect and the imaging couch. Hands should be kept on the chest to bring them away from the primary beam. Knees should be flexed and feet should be kept on the tabletop to reduce the lumbar curvature. Therefore, give a good contact between posterior aspect and the imaging couch. Then, direction and centering of the X-ray beam. The vertical center ray is used. Beam is perpendicular to the IR. Center point is on the midline 1 cm above to the line joining the iliac crest for normal abdominal pathologies, and for KUP examination, the center point is on the midline at the level of iliac crests.